Hey everybody, welcome back to another episode of Daily Doc Talk. I am your host, Dr. Drew Timmermans. I wanted to make this video to help people out there who have had injections done with other providers and you're not sure what the next step is. You're not sure if you should get another treatment. You're not sure if you should seek out another provider. You're not sure if you should seek out a stronger injection, like getting a stem cell treatment compared to a PRP or something like that. So I'm going to talk you through how I think about response rates and individual responses to injections with my patients in office, and hopefully that gives you some insight into how you can approach your specific situation. So I'll break this down for you into different scenarios. So if I treat a patient and they come back to me and they have had no response to the treatment, it tells me 100% that I did not treat the correct area, okay? Because when we are using the therapies which are invasive, the injection therapies, if we are not targeting the tissue that is inflamed, that is the pain generator, that is degenerative, and of those three, what really matters is it's the pain generator, then we're not going to see a response in your pain. And so if, for example, your pain is coming from your medial collateral ligament in your knee, and I don't treat that, or another provider doesn't treat that, and they treat just intra-articular and maybe some other tissues, but they don't get the MCL, then it is unlikely that your pain is going to drastically change because that tissue was not treated. And so if a patient comes back to me and they had no change in their pain, my first place that I look is, what did I miss? What pain generator did I not find in the initial evaluation that led me astray, and therefore I did not treat it? So if that is you, if you have had prolotherapy from a provider and you had one treatment and it did not change your pain, the solution is not going to PRP. The solution is not getting another prolotherapy treatment for the same tissues. The solution is having your provider figure out what structures were not treated that are the actual pain generator and can now be treated, or finding a new provider if that provider doesn't realize that they missed something. So that's the first scenario. Second scenario is patient comes back and in some areas of pain, they had improvement, in other areas they didn't. Well, that tells me that some of the areas that I treated are part of the pain generator, but there was still an area that was missed. And so again, in that situation, repeating treatment for what I did is going to be important because we know that that improved part of the pain, but still reevaluating to find a new pain generator or one that was missed in order to actually treat that and to see an improvement. The next scenario is a patient who comes back who has had a moderate response to the injection therapy, but it's a response that they've had over all areas of their pain. And so all aspects of their pain improved by 30 to 40%. In those situations, there's two potential ways you can go about it. You can either repeat the treatment, or you can take a step up in the treatment that was done in order to get a better clinical outcome. So an example of this, if you're having knee pain and you had prolotherapy done, and after 6 weeks, you have plateaued in your response and you are 30 to 40% better. The two options that I give my patients, because both are valid, is you can receive another prolotherapy treatment, and we hope that you achieve an additional 30 to 40% response. However, what we tend to see is that the closer to 100% response that you are, the smaller your response rate is going to be. And so if we see 30 to 40% after the first treatment, we might see 20 to 30% or 25 to 30% on the second treatment. And we're basically going to get diminishing returns the closer we get to 100%, and that's normal. And so we could repeat that treatment, or we could bump up to something like PRP and hope for a better than 30 to 40% response rate. And so example, we get 30 to 40% response from prolotherapy, we repeat the treatment, and we get an additional 50% response. So now we're upwards of about 80 to 85% response rate, or 80 to 90% response rate, as opposed to less if you had to just continue with prolotherapy. Again, obviously, PRP is more costly than prolotherapy, so that's not the best option for everybody, but it is one of the options that we can do. Then the last response that we can have is a patient comes back and they are 80% improved after their one treatment. Then the question is, what does the patient want? If you are satisfied with that 80% improvement, then there's no need to repeat the treatment at that time. But if you're looking to be 90 to 95 to 98 to 99 to 100% better, then another treatment could be warranted. And if you got 80% improvement off of one treatment, whatever that treatment was, repeat it because it works. So bringing this back around and compressing it into the gold nugget of this is, if you had a regenerative injection treatment by a physician and it did not change your pain, it doesn't mean that regenerative injections don't work. It means that the provider did not treat your pain generator. If your pain generator is not treated with these injections, it is unlikely that you're going to see a major shift in your pain. If you guys have any questions about this or want to know more about this, leave a comment below and I would love to answer them. And I hope you have a wicked, wicked day.